On the Central Coast, we know that homelessness is an issue. It has been for a long time, and it's an issue that's been exacerbated by the pandemic.
It's been a phenomenal couple of years since COVID, which really shone the light on how many people were really out there. Because when all of us went inside, that's who was left outside. It's so hard to walk down a street and see someone who you know has nowhere to go.
Oftentimes we'll hear people ask, well, is anyone going to do anything about the homeless crisis in our communities? CalAIM is an answer to that question.
HIP, or otherwise known as the Housing and Homelessness Incentive Program, is an incentive program from the state that will allow the health plan to work with our local community partners to address the issue of homelessness in our communities.
One of the exciting elements of CalAIM is the opportunity for CenCal Health to work with non-traditional providers throughout our community.
The local homelessness plan is required for us to access monies from the state. We worked with our community partners to craft a strategic plan on how we will collaborate. The goals of HIP is to, one, build partnerships at the local level between the health plan and community partners who are serving our homeless population. And it's also to work together through partnership to prevent homelessness and to decrease the numbers of individuals who are experiencing homelessness. It will allow us to fund partners who can take healthcare services to where our homeless, unsheltered members are.
Doctors Without Walls is an organization that has been in operation for 15 years in Santa Barbara County. We provide backpack-based medicine to the unsheltered homeless in South Santa Barbara County.
Before CalAIM, the services provided by Doctors Without Walls could not be reimbursed by CenCal Health, and Doctors Without Walls relied on the goodwill of hundreds of volunteers, the majority of which are clinicians and pre-med students who deliver care free of charge.
CalAIM is a dream come true for me. My biggest thing is sustainability. We have to be able to sustain street medicine. Street medicine gets to a population of people that no one else reaches.
So CalAIM will support the homeless community and the providers by being able to have better access to care and care coordination.
CalAIM is going to allow street medicine providers to become case managers and be able to follow up and make sure that our clients are getting all of the services that they need, all with the hopes of getting them housed. It's going to allow us to buy portable ultrasound machines so that we can do point-of-care testing for people that have hematomas, just so that we can diagnose a little bit further.
Yes, it is true that we have a housing shortage throughout Santa Barbara and San Luis Obispo counties, but we have to start somewhere. And offering these homeless members of our community assistance with finding a housing location, with understanding what it means to be a tenant and to keep your housing, and with basic expenses such as first and last month's rent and a deposit is that first step.
I see people that can come in and out of homelessness, but because we've got such an incredible support safety net that's been created through all the services and the things that we're doing right now, I see that people are not going to fall through the cracks.
HIP will be sustainable because we've built the partnerships to deliver coordinated services to our unsheltered population. It will also be sustainable because we've built the data infrastructure for coordinated care.
This is a long-term approach to issues that have been present for decades, and it's going to take time to change. Time to build these resources. This is the first step.
For me, the dream is that that's what our community will look like. Our community will simply be helping people that are in a difficult situation, but getting them right back into a place of respect, a place of safety.
Doing healthcare is more than just giving some medication or diagnosing a little bit of illness here and there. It's about trying to improve a human being's life